Welcome to the show. I'm Gloria Elliott, Director of the Charlotte Banks Initiative at UNC Charlotte. What we're going to be talking about today is organ transplantation and the role that UNC Charlotte researchers are playing in addressing some of the unmet needs in this healthcare area. The shortage of organs that are available for transplantation has long been recognized as a major public health challenge, not just in the US, but around the globe. There are currently almost 3,000 people in North Carolina waiting for a transplant, and that number is 120,000 nationally. There are many factors underlying the shortage, but the one that we're focused on here at UNC Charlotte is the issue of preservation of organs. The Charlotte Banks Initiative is focused on one particular aspect that we think could transform this field, which is the development of technology to extend the storage time of organs, the time between organ harvesting and transplant. Although the times vary between organs, the current storage periods are measured in hours. That places tremendous pressure on procurement and transplantation teams to match organs and get those organs where they need to be in the amount of time available. Organs are often rushed to their location by helicopter or jet, adding to the logistical issues and costs. Joining me in the studio today to discuss these challenges is Jerome Menendez, Executive Director of LifeShare of the Carolinas. Welcome, Jerome.
Thanks for having me.
So Jerome, maybe you can tell us a little bit about the role that LifeShare plays in the transplantation process and give us your thoughts, how you think advances in preservation could have an impact on the transplantation field.
Sure. So a little history about LifeShare. We are the federally designated regional procurement organization. We cover about 52 hospitals in 23 counties, primarily in southwestern North Carolina. And I like to think of us as serving as a bridge between the patients who need life-saving or life-enhancing organ, eye, and tissue transplants and those donors who make those gifts possible. So when we talk about transplantation and maximizing organs, anything we can do to increase the number of organs available, we're always interested in fostering a collaborative relationship.
Well, what has excited me about this project is the opportunity that it provides for the university to really combine our strengths across many disciplines and to have an impact on a health problem of both regional and national significance. If we're able to realize this vision, which is a repository for donated organs, this notion of a wait list for organs could be a thing of the past. From your perspective as an organ procurement organization, what other areas of research do you think we could or should be exploring as part of the Charlotte Banks Initiative?
We tend to look at the social and behavioral aspects of organ donors and their families. We're very interested in those families or those potential organ donors who choose not to donate. And we want to look and see if there are any sort of patterns or common themes that we may be able to address with the hopes of improving consent rates for organ donation. You know, it's interesting, one of the things that we've looked at, of the 120,000 patients on the waiting list right now, about 90,000 of those patients are waiting for a kidney transplant. Of those 90,000, about 50% of them are African American or Black Americans waiting for a kidney transplant, yet only about 14% of African Americans or Black Americans tend to be organ donors. And so it's always exciting to come to a school like UNC Charlotte that's so culturally rich and culturally diverse so that we can tap into the mindsets of some of the young folks and really get a good understanding of why these decisions are made not to donate. And as you mentioned, the allocation algorithms, one of the things that's very important as it relates to organ allocation is equity, making sure that the right people are offered the correct organ at the correct time. So anything that improves the organ allocation scheme is obviously going to be a win for the patients on the waiting list.
And this is certainly something we're really interested in digging into here. So as you know, Charlotte Banks came together with LifeShare of the Carolinas to host Conversations of the Heart on Valentine's Day this year. This was a public symposium that brought together stakeholders from all aspects of the organ donation life cycle, and we thank you for your participation in that event. But what are your thoughts on how partnership on events like this can bolster our impact in the Charlotte region?
I think the biggest thing that these sorts of events and this sort of collaboration offers is public awareness. Again, using the Charlotte Banks event on Valentine's Day, we were able to put together a beautiful story on one of the local NPR affiliates about a recipient and a donor mother meeting and sharing experiences. So I think things like this really can improve public awareness, offers us the opportunity to educate the public further on organ donation, and not only organ donation, but also eye and tissue donation, which, while they might not be life-saving, are certainly life-enhancing.
Well, thank you for being here today.
Thanks
We
again for
appreciate your
having me.
time.
Thank you.
Well, we're going to take a short break and come back with Jedd Lewis, President and CEO of the Organ Preservation Alliance. Welcome back to the show. I'm here with Jedd Lewis from the Organ Preservation Alliance. Welcome, Jedd. Can you tell us a little bit about the Organ Preservation Alliance?
We're a science advocacy nonprofit that's worked on one of the key bottlenecks in transplantation, regenerative medicine, basic research, drug discovery across all these different fields, and that's being able to preserve, being able to store, transport organs and tissues outside of the body.
So from your viewpoint at the national level, can you comment on what you perceive to be the need for tissue and organ preservation?
I guess a way that I like to describe it is, imagine if you couldn't put milk in the fridge, but that milk saves lives, and it saves lives every time you drink a glass. In transplantation, through providing resources for research, reconstructive surgery for our wounded warriors, and when you put all of the different needs together, needs to be able to provide these kind of logistical capabilities in these different fields, you're talking about millions of lives that can be saved or changed worldwide.
What are the major logistical issues in transplantation that you believe preservation could address?
So the state of the art today is that maximum organ preservation times are measured in hours. So in the shortest cases, that's transplant heart and lungs, you've got about 4 to 6 hours to get that organ from the organ donor to a transplant center that could be far away because you're trying to match it to the patient who needs it the most and whose immune system is most likely to accept the organ. So one of the things that this could do is allow us to use thousands more organs each year from existing donors. So you have marginal, hearts, kidneys, livers, lungs that today wouldn't be considered viable for transplantation. But if you had these longer time windows to match them better, to run more tests, use more technologies to assess whether they're safe to transplant into a patient, then you'd be able to make use of a lot more of these organs. So one of the other big challenges that we face in transplantation is not just having enough organs, it's making those organs work as well as possible. And one of the big challenges there is that once an organ is transplanted, the patient has to deal with chronic immune rejection for their entire life after the transplantation. So their immune system attacks the transplant organ, and they have to take immunosuppressants, they have to take drugs to deal with this problem. Immune rejection can be a lot less of a problem in cases where you match a donor and recipient more closely. So being able to widen these time windows, widen the geographic distances over which you can match a transplant donor and recipient can give those patients more quality of life, can make the organs last longer, make the organs healthier for the rest of their lives.
What are your thoughts on how the Charlotte Banks Initiative fits into the national landscape?
Addressing this need of being able to preserve and bank transplant organs and a lot of other tissues for all these different purposes, this has become a national movement in the last 2 to 3 years. I think the big lessons that have emerged from that have been kind of embodied in the Charlotte Banks Initiative, and this has really become a model for how these problems should be tackled. So it's inspiring and it's incredibly exciting to see what comes out of this at UNC Charlotte.
Well, thank you for those comments, Jedd, and thank you for being in the studio with us today. I think the opportunity to save millions of lives globally by making organs accessible to all that need them is within our reach. Thank you for watching.